KYKS, good morning, and welcome to the Merrell in the Morning Show. And once again, teaming up with our friends at St. Luke's Health-Memorial in Lufkin. February is Heart Month, and we've done this now for quite a few years every February, where we educate our listeners on being more heart healthy and what they can do to take care of their hearts. And this year's theme is "You Depend on Your Heart, so take care of it." St. Luke's Health-Memorial can help, and we welcome to the studio. We have Nancy Perez Jacob, who's a cardiac rehab nurse manager. We also have Cody Lindsey, who is a certified exercise physiologist. Did I get that all right?
Sir.
All right, very good. And both work at St. Luke's Health-Memorial Cardiac Rehab Center, which is conveniently in that same building as the Heart Institute of East Texas. Welcome. So let's talk about, I know that you're members, of course, of the cardiac rehab team, and much of your work is done after a patient has been identified with a specific heart condition or undergone a recent heart procedure. So let's begin by explaining what cardiac rehab is.
So cardiac rehab is a 36-session progressive exercise regimen that is individually prescribed for each patient with a specific either heart condition or if they've undergone a heart procedure.
Okay.
At our facility, we teach our patients how to be more active and make lifestyle changes as needed, and to ultimate goal to lead to a stronger heart and better health.
And of course, everybody's different, so there's a plan that's different for everybody. It's not a cookie cutter approach for cardiac rehab. So your program identifies the needs of each patient. You design a protocol and regime for that best addresses those needs. So tell us more about how that assessment process works.
Yes, sir, that's correct. Just like as a physician would, write a prescription of medicine for that patient, it's my job as exercise physiologist and one of our other exercise physiologists as well to write a prescription of exercise for that patient, depending on their needs.
Right.
We take into account their specific procedure, what they've had done, whether it be a heart attack, cabbage procedure or whatever. But also like if they have, COPD, if they're diabetic, any type of comorbidity that they may have with their, qualifying diagnosis as well.
And of course, also their personal goals go into this as well.
Yes, sir. So we have people coming in that, they really can't climb stairs as well. So, that's something that we're going to focus on, try to make them reach that goal. Some come in, wanting to get back to playing golf or, maybe adding a few yards on their driver.
Sure. So, there you go.
So that we'll try.
Oh, don't make that promise now. There'll be folks out there saying, "Hey, I just want to come in and get you."
Yeah, exactly. But we take into their personal goals and any other comorbidities that they may have.
So what is the overall cardiac rehab program goal?
Ultimately, is to decrease the risk of developing or experiencing another heart event. And we do that through risk factor identification modification. So risk factors will be, their blood pressure, are they diabetic, are they a smoker? We strive to improve their functional capacity. That just means what they're able to do as far as physically. And for every 1 MET of improvement in their functional capacity, there is already a 50% risk reduction of them having to have either another event or another procedure. So that's definitely very, very important.
Of course. And how does someone know if they are in need of cardiac rehab?
So if they have undergone coronary angioplasty or have had a stent placed, heart attack is another qualifying diagnosis, heart valve surgery, transplant, those that have stable angina or, chronic chest pain, and certain degrees of heart failure as well.
I mean, so let's talk about this. Here we have somebody that, has undergone or has experienced one of those things that you've talked about, whether it be cardiac arrest or heart transplant, something obviously, something big involving the heart. And so they're already stressed out. They're, and they come to you trying through cardiac rehab, something they've never gone through before. How do you kind of lessen that stress level and make them comfortable with what you're doing there?
Funny story, because when we first opened back in March of 2014, our very first patient, after we did his first initial evaluation, he said, "Thank you." We're like, "Well, you're welcome." And he's like, "Thank you for talking to me, not at me."
Right.
And so that really made an impact whenever he made that comment. So we continue to do that to this day. A lot happens when you're in an acute event in the hospital. Everything goes really, really fast. You're seeing new faces every day, whether it's your personal care team, as a physician, as a specialist that's coming in. There's a lot happens, a lot of education happens really, really fast. And that's just how an acute hospital stay normally occurs. So whenever you come to us, we're a little bit more on the after fact of it, and we take a little bit more time because we do have that time. So that is one of those things that we do have. And so each patient is different. There's many different personalities of our patients. We've been blessed to work with a lot of patients, and each one of them brings something unique to the table. Our ultimate first goal is to learn what the patient, what is it they enjoy the most? What led them to see us? Next, we work with them to assess those risk factors, their goals, what they want to get back to doing, as well as the challenges that they may have faced along the way as their heart journey, whether it was open heart surgery, whether as they had no idea they had a heart condition until they came to the ER and they say, hey, you need to have, you're having a heart attack. And they're like, what? I just thought I was just having indigestion for the past 6 months and so forth. So we do encounter challenges ever so often, but we've been blessed to be able to mitigate much of those through our relationship building with our patients.
Now, of course, you mentioned how every patient is different. You treat them differently, obviously, and develop a custom plan for them. At the same time, there are some common things that each person will have to go through. So let's kind of go through the process here. What can somebody expect on their first day when they walk into cardiac rehab?
Yeah, so initial evaluation is probably going to take around an hour and a half to 2 hours. We're going to go over their medical records, their diagnosis, any questions that they might have about medication, so on and so forth, and set some goals with them. Our nurses will come in, they'll do their nursing assessment, and then exercise physiologists will either, do a walk test or a treadmill test with them, depending, like their functional capacity where they start at. Because that's going to give us a good baseline and able to track their fitness and make sure we're staying on track with their goals throughout their program.
Okay. So I would obviously be part of the cardiac rehab team. You've got to work really, really closely with the cardiologist in this, right?
Yes, most definitely.
Okay. Can you kind of tell us about that work?
All right, so our cardiac rehab staff does definitely work very closely with our cardiologists and also the physicians that refer them to our department. We ensure that each patient is very well taken care of. Dr. Botcheretti was also our medical director. He does visit our department, if he can, daily, but if not, several times a week. And he just touches base with us. How are you doing? Is there any issues, any safety concerns? Is there anything I can do?
Sure, yeah.
He even sees his own patients there, and they chit chat. He's a very, very hands-on approach with them. A physician or cardiologist, will provide that initial order for cardiac rehab. After the event, we get to see the patient a little bit more often than the physician or the cardiologist does.
Yeah.
Because they have 2-week follow-up, 1 month, 30 months, 6 months, so forth. But we actually see them a little bit more often, whether it's maybe 2 to 3 times a week or even maybe once a week. And so we develop, that relationship with them. One of the neat things is that they are on telemetry monitoring, which means that they are wearing a heart monitor the entire time they're with us.
Right.
And just like a fingerprint is unique to each individual, their heart rhythm is also unique to each individual.
Really? Okay.
So there's like a unique fingerprint. So we are able to say, okay, that doesn't look right. This is not what we're normally used to seeing. And therefore, we're able to pick up on those little things. We notify their cardiologist or primary care physician, and then they'll take it from there. Where, okay, there's something that needs to be addressed. Let them come to my office, or let me go up and see them if their cardiologist happens to be in the same building as we are. So that's all. That's also one of those things that is a benefit because we see them a little bit more often, so we're able to pick up on these little differences a little bit sooner than they would if they had to see their physician in 3 more months.
Right. So, obviously, the services that you offer are fantastic. You're getting somebody back to being heart healthy again and recovering from this. But, of course, there's always the question of cost. So what about insurance? Does insurance cover what you do? So
Medicare and most private insurance, they cover cardiac rehab. Now, insurance plans vary. But if any questions of that, our registration department is extremely helpful.
We're coming up now on the 10-year anniversary of the cardiac rehab units. And as you mentioned, that first patient that comes in and says, thank you for talking, talking to me and not at me. So what has it been like over the past nearly 10 years that you've been a part of the cardiac rehab program?
Well, now that you say 10 years, wow. Yeah, definitely. I came over to that to cardiac rehab in 2014, and so yes, those few months definitely flew by. It was a new department for the hospital, And it was made possible through the partnership between the hospital and the Heart Institute. We were confident that we had a good plan for implementing this entirely new department. It had to be built from scratch.
Right.
But we didn't expect to double not only our staff, but our equipment twice before our first year of opening. And as to this day, we continue to grow. We started off with 1 full-time RN, 1 part-time exercise physiologist, and a PRN CNA. Now we're blessed to have 3 registered nurses, 3 exercise physiologists, and 1 CNA.
So, obviously, through the years, I would imagine hundreds, maybe even thousands of persons that you've worked with that have been through some pretty amazing recoveries. I'd like to go ahead and highlight some of these patients, if you don't mind. First of all, tell us about working with Valley Ann Kerr.
Miss Kerr. When you think of her, you just see her smile. She has this big, glowing smile. And actually with her, she actually did the program back in 2017.
Uh-huh.
And to unforeseen circumstances, she wasn't able to complete it. But she's one of those patients that makes an impact, and you recognize the name, you remember that face. And so we received another referral for her back in mid-2022, which was just last year. And I called her and to schedule for her first appointment. And actually, she had deteriorated from the time that we got her order in for me able to get a hold of her. And she was actually in an inpatient rehab facility.
Uh-huh.
At that time. So I kept in touch with her every few weeks. I would call her to see how she was doing. I think I'm going to be discharged. And then I didn't hear from her for a little bit, and she wasn't at the facility anymore. And then we got a new order for her, and it turned out that she actually had undergone open heart surgery. She had heart transplant.
Right, uh-huh.
So she's definitely a hard worker. She has achieved so much. You can just tell her, from comparison from when we first met her in 2017 to after her heart transplant. She had a glowing personality there, but she is even more glowing now. It's really neat to see that, that change in her. She is right now our first heart transplant, has been able to complete cardiac rehab, and to this day she continues to adhere to risk factor modifications, and she continues to work out with us. And now as our phase 3 patient. And she's also transitioned and our new patient encourager. She sees a new face and she's
really?
right there. Hey, I know you're scared. You may not like this, but keep it up, and these guys are going to help you out.
And it's great to see how the entire team and how the entire process works. We were talking with Dr. Saini about, how the VT ablation was able to actually buy her some time so she could get that heart transplant and then come to you guys for the cardiac rehab. And now she's a greeter.
Definitely.
I love it. Somebody else we want to talk about, another patient, is somebody that's as a name very, very familiar with folks in East Texas, former Lufkin ISD Superintendent Roy Knight. So if you could tell us a little bit about him.
Oh, yes, sir. Mr. Knight, he definitely has a story. He was home, experienced chest discomfort, came to the emergency room, and was having a STEMI,
right?
So a heart attack. Went to the cath lab and was going to undergo stent placement. That's where he went into cardiac arrest and resuscitated, and now he's here at cardiac rehab with us. Really getting after it. Really pleasure to work with him. A true survivor story.
Outstanding. So obviously your patients, you come to love their stories, come to know them and trust in their respect. There's that goes both ways. And it's even evidence in such things as the thank you notes that you receive from them. Does that kind of validate on a personal level that you've chosen the right profession?
Most definitely. We see so much progress from when a patient first comes through the door to when they finish their sessions. We become very well acquainted with each other over the months, and we thoroughly enjoy every moment. Like Miss Kerr,
sure,
coming in on a walker, and now she's walking 2 miles on the treadmill. So it's always a blessing to see.
That's a great personal feeling,
yes,
I'm sure. We talk a lot about the different accreditations, the numerous accreditations, and that's received by St. Luke's Health-Memorial, but of course also on the cardiac rehab level as well. You have a national accreditation with the American Association of Cardiovascular and Pulmonary Rehab. What makes that accreditation important, and are you still the only one that's accredited here between Houston and Tyler?
Yes, sir, definitely. We are very proud to have achieved our national certification. The first year we were even eligible to apply, and to this day, that is correct. We continue to be the only nationally certified cardiac rehab program between Tyler and the Houston area. This is definitely a huge accomplishment for us because it's a testament to our efforts of providing high-quality care to our patients, staying up to the latest research, up to date with that, and providing, that high-quality patient care and service for our patient population.
Okay, so if somebody is interested in going through cardiac rehab with you guys, what's the process? Do they contact you directly, their cardiologist, their primary care physician? How does that all work?
Yes, sir. So they can contact us directly. Our phone number is 936-634-8840. For any questions that they may have, they can also reach out to their physicians to determine if they qualify for our program. And also their physician's office can reach out to us, and any questions they might have, we can answer them as well.
Okay. Any parting thoughts you guys would like to share with us?
Well, obviously February is Heart Month,
Right.
and just having a heart condition does not mean that you cannot improve or make any changes. Day one starts with you, and we are happy and willing to help in any way that we can possibly can. Not only do we strive to make your heart healthier and stronger, but we do have a little motto in our gym because we can be goofy a little bit times. But we do say, hashtag making heart smile.
I like that. Very well put. All right, Nancy, Cody, thank you very much.
Thank you.